Hi there, and welcome to Plan to Protect with Melodie Bissell, the safest podcast on the internet. My name is Joshua Bissell, and I'm the editor of this weekly podcast, where we tackle topics of abuse prevention and vulnerable sector protection. This week, Melodie's back with us, and we're going to be continuing on our series of why various sectors of our society are particularly vulnerable to abuse and those who would abuse the vulnerable. Melodie's going to be doing a deep dive into nursing home abuse and why the nursing homes and elderly care facilities in our society are vulnerable to abuse, and why we hear so many stories these days of abuse happening in nursing homes and elder care facilities. Thank you for joining us, and we hope you enjoy this week's episode of Plan to Protect with Melodie Bissell, the safest podcast on the internet.
Thank you so much, Josh. This has been a good month. Over the last month, as you know, we have been unpacking why abuse is prevalent in different sectors. We examined the faith sector, the education sector, the camping sector, the sporting sector, and today we are going to make a little bit of a shift and focus our attention on nursing homes. Why is abuse prevalent in nursing homes? With such a high prevalence of nursing home abuse cases in the news, it may seem alarming that it continues to occur. However, change cannot occur until the reasons for the abuse are thoroughly examined and rectified. I want to begin by saying that I have recently become an essential caregiver in a nursing home for my 87-year-old mother-in-law. She has Alzheimer's and is currently not eating very well. Almost a full year went by when we were not able to visit my mother-in-law because of COVID. We only live 5 minutes from the nursing home, but because of COVID, we could not go and see her on a regular basis. Until a few weeks ago when we received a phone call from the nursing home to say that she had stopped eating and hardly was eating at all. And we asked if we could go in and become essential caregivers. The nursing home that my mother-in-law is in is a well-run, amazing care given to the residents. And we really appreciate Parkview Homes in Stouffville. Today, my husband and I take turns going in to see my mother-in-law and providing her essential care, helping her with her dinner meals. As I said, almost a year had gone by, and we saw a real decline in her health, not because of any lack of care, but just because of her aging and her health and the Alzheimer's. Unfortunately, not all elderly individuals have the same advantages and same care that my mother-in-law has. Often you can read in the newspaper and hear on the radio and in television about elder abuse that is happening in nursing homes. A year-long CBC Marketplace investigation revealed that abuse is prevalent in nursing homes. Marketplace compiled 6 years of data of long-term care homes in Ontario, including critical incidences of abuse and neglect that happened within these long-term care homes. The number of incidences was compared with the number of licensed beds in each home to calculate a rate of abuse. The investigation reveals that staff to resident abuse increased by 148% from 2011 to 2016. That was the most recently available data. There are many reasons why nursing homes have a high prevalence of abuse. The causes differ depending on the long-term care facility, the quality of the care provided, the caliber of the care staff, the supervision and accountability of that care home, and the overall facility management. Types of nursing home abuse include physical abuse, general neglect and failure to provide basic needs, violence, emotional abuse, psychological abuse, sexual abuse, and financial abuse. Nursing home neglect can be committed in a number of ways. Leaving residents unattended for extended periods of time, allowing residents to remain uncleaned in their own bowel movements, failure to provide the necessities of life, food, water, and care, chronically forgetting or improperly administering medication, failure to provide regular baths, even when requested by residents, holding back medical care, over medicating an individual, not ensuring that the residents' rooms are properly cleaned, poor hygiene, dismissing or ignoring the residents' complaints, whether they are against staff or other residents, not reporting injuries or illness to medical staff, physicians, family members in a timely manner, and failure to ensure the safety and security of all residents from visitors. As many of us know, many nursing homes are privately owned and they are not for profits. A nursing home lacking resources and professional management and supervision is a challenge and difficult to operate. This causes the quality of care to sometimes suffer and perpetuates the neglect and even abuse. The type of residents and their unique needs also play a role in how nursing homes respond to abuse and how abuse could happen within the home. High need patients, women, veterans, residents with severe and cognitive disabilities are often targets of abuse and neglect. I should say here that my mother-in-law, up to a year ago, was 86 years of age. She'd been diagnosed with Alzheimer's almost 15 years earlier. And honestly, she was the happiest Alzheimer's patient. She was happy, she was grateful. She would play the piano, sing, very, very grateful for anything anyone did for her. This is where we saw a shift when we went to see her after almost a year lapse in the opportunity to visit because of COVID. We now notice that my mother-in-law can easily become angry and irritated. When we try to feed her, she pushes our hand away and snaps at us easily. We now see my mother-in-law is responding like many individuals respond when they're older. They're tired of living, they're not feeling well, they feel sorry for themselves, or their behavior or cognitive issues at play. Here are just some of the reasons why experts feel that nursing home abuse occurs. I'm going to mention them quickly and then I'm going to unpack them a little bit for us. Staff shortages, lack of staff training and experience, underpaid staff, poor supervision, management, and accountability, individual caregiver issues, individual resident risk factors, individual residents' responses and reactions, and access to visitors who could take advantage and abuse a resident. Let's unpack these during our podcast today. Understaffed workplaces. We heard about this often during the past year with COVID, how the staff either were becoming ill, staying home because of fear of transmission of the disease, and there was a shortage of staff. Nursing homes can only operate to the best of their ability if they have the staff required to fulfill their duties. Staff can only provide the care and the highest possible standard of that care if they are supported by other staff members and team members and are working in a team environment. As soon as any type of organization, especially a nursing home, faces a staff shortage, responsibilities get dropped. Standard of care and certain duties are neglected. Shortcuts are made. This is because staff members are forced to start prioritizing certain needs of residents over others. Over time, this neglect can lead to long-term failure to provide basic need, which can constitute abuse. When a nursing home is chronically understaffed, it creates a very stressful environment and hostile environment among the staff. The staff may easily become disgruntled and bitter, feeling unsupported and ill-equipped to do their jobs. Understaffing is especially bad across the nursing home industry. A low ratio of caregivers to residents means existing staff is more likely to miss severe issues and recognize some of those issues. Other staff members may take their frustration out on the residents, which can occur through physical or verbal abuse. Another reason why abuse is prevalent is because of undertrained staff. Nursing homes may have many staff members. However, if the individual staff members are not properly trained or do not have the experience, they cannot perform all their job duties. Additionally, if the staff do not receive ongoing training to adapt to the shifting needs of the residents, they cannot perform the necessary care that is required. Part of that staff training has to be training on elder abuse and elder abuse prevention, both awareness and prevention. Improper training ultimately impacts the residents and their quality of life. Staff must have the experience and the education to be able to provide that personal care, the medical attention, and other supports for elderly people. Without this training, a number of unfortunate consequences can ensue. A lack of support and care is considered nursing home neglect. If the situation worsens and residents are deprived of having their basic need of food and health care provided, it may be considered nursing home abuse. Undertrained staff can come in many forms, not having the required education and vocational training, asking individuals who have not had that training to do the work of a personal support worker or nursing staff, not having work experience, background experience in nursing home environment, not being trained on specific policies within the nursing home, a lack of understanding the rights of residents, a lack of ongoing on-the-job training requirements, inadequate training for specific disabilities, illnesses, and needs. In many cases, staff within nursing homes do not feel that they have the tools and the resources they need to be able to handle aggressive or violent residents. A common symptom of old age is developing aggressive behavior due to cognitive decline. Often that elderly resident aggression is towards the caretakers. The majority of nursing homes are privately run businesses. Because of this, there is not across the board standards of pay for personal support workers and nursing care staff. In turn, some nursing home staff members are paid more than others depending on the nursing home. Many nursing home caregiving staff members feel very underpaid and undervalued. Therefore, they are less motivated to provide high levels of care. Without motivation to provide a certain standard of care, many residents become neglected or abused by staff members who do not feel compelled to help go above and beyond. Over time, this leads to low morale, which creates a culture of accepting low standards of care. Even in the best run nursing homes and long-term care facilities, where there are full staff, great ratios, well-trained individuals, the center is very well managed, you'll still encounter rogue individuals who commit abuse for their own personal gain and reasons. Like anywhere in society, there are always certain individuals who want to take advantage and cause harm to others. Yes, sometimes even these individuals will work within nursing homes directly with senior citizens. Individual care issues often don't start off that way. We see that someone may have started off with a career in a nursing home as a personal support worker, as nursing staff, with a commitment to care for those that are elderly. However, over time, they may experience burnout and stress, personal issues at home, substance abuse, poor personal health and illness, mental illness, or their own personal history of being abused. Because these individuals are dealing with their own personal issues, they bring those frustrations and issues into the workplace. Instead of having outlets for their frustration, and because they're so often working in isolation, they act abusively towards the residents who are in their homes, who are easy targets. Another reason why we see abuse prevalent in nursing homes is because of poor nursing home management. This is a reality that we see in many nursing homes. Some nursing homes are certainly run so much more efficiently than others. If nursing homes do not have strong leadership, management, and supervision, standards slip and neglect can occur. If nursing homes do not strive to achieve that high standard of protection and abuse prevention in regard to resident care and caring for staff members, they don't feel compelled to provide it, and abuse can occur. In many cases, there is lack of consequences for poor management, poor supervision, and poor care. We often hear about abuse that happens within the nursing homes where one resident abuses another resident. Just in the last couple of weeks, I read a newspaper article about a man within a nursing home that was found in the bed of other residents, sleeping with other residents and abusing those residents. Some residents are more at risk than others. For example, my mother-in-law, who has Alzheimer's, is certainly at high risk. A resident who has dementia would be at high risk. Because of their cognitive illnesses, they do not remember what they had for breakfast or what they had for lunch, let alone the harm that was done to them. I can remember moving from Michigan to Toronto to care for my elderly grandmother. She was in a long-term care home, and she would beg me to take her out of that long-term care home. She would tell me that at night, people would come in and harm her and do things to her. At the time, I was naive. I didn't know what I know now. And I would just say, "Oh, Grandma, you're just dreaming those things. Those things didn't really occur." I wish I knew then what I know now, because I would ask so many more intentional questions. Whether an individual has cognitive illness, mental illness, physical disabilities, perhaps they have access to wealth and people are trying to take advantage of them, or because of their gender, they may be so much more susceptible to abuse. You only have to spend a few hours in a nursing home to realize who on that floor is aggressive and unkind to other residents and to staff. They can be verbally aggressive, physically aggressive, and very unkind. That requires elevated supervision and monitoring. A few years ago, my husband and I were alerted to a couple that were coming in to visit my mother-in-law on a weekly basis, sometimes even more often than that. The nursing home care staff asked if we knew these visitors, and we didn't. And they raised a concern that they felt these visitors were trying to take advantage of my mother-in-law. Because of her cognitive disability, they were asking her for financial resources and trying to get access to her banking information. In most nursing homes, up to the time of COVID, individuals could come and visit residents in nursing homes, and all they were required to do is sign in at the front desk. Family members, caregivers, and staff should monitor who is coming in and gaining access to the residents in nursing homes. Family members should visit frequently. Even during these times when we have restricted access to visit seniors and the elderly within nursing homes and hospitals, we should still check in with phone calls, Zoom calls, or make yourself available to be an essential caregiver. While less commonly thought of, family members who visit senior residents in nursing homes are in a unique position to commit abuse. They can easily grow impatient and unkind to the family member. Family members can continue to perpetuate any kind of abuse against a resident, including physical, emotional, sexual, and financial abuse. The nursing home still has a responsibility, as stated by the government, to protect its residents from even abuse carried out by a family member. It's vital for professional staff members to be aware of the interactions that occur between family members and the residents and recognize the potential of abuse. That's why at Plan to Protect, we strongly recommend that the training that you provide to your staff be abuse awareness, prevention, and protection. Most long-term care homes and residents within Canada and United States have a legal duty to report abuse if an elderly person is living within that home. Nursing home staff should take all complaints and concerns very seriously when it comes to their residents, relationship with their family, and staff members. In conclusion, there are countless factors at play when it comes to nursing homes and abuse that can occur in nursing homes. Each nursing home operates under its own policies and procedures. Family members should ask to see those policies and procedures. At Plan to Protect, it is our privilege to write policies and procedures and provide training on elder abuse prevention and awareness. Family members should do extensive research when selecting a nursing home for your loved one. Look at the staffing level, the staff wages, the management style, and the nursing home history to get a better feel for its overall care capacity and philosophy. It is very concerning that abuse happens at the beginning of someone's life and at the end of someone's life. We must honor our seniors and the elderly. We must provide care. At Plan to Protect, we are committed to providing the highest standard of abuse prevention and the protection of the vulnerable sector, including the elderly. At Plan to Protect, we join you in a commitment to help prevent abuse from happening to the elderly. One of the resources that we have available for distribution within nursing homes is our Plan to Protect Pocket Guide of Best Practices for Vulnerable Adult Care. If you would like a copy of the Pocket Guide of Best Practices on vulnerable adult protection and abuse prevention, please reach out to us at info@plantoprotect.com. We have these pocket guides available and would welcome the opportunity to make them available to your staff within your nursing homes. Thank you so much for sticking with us through this series. Perhaps you listened to only one of the sessions for the sector that you work in directly, but each one of us knows someone that we can forward these podcasts onto. Even if you normally work with children and youth, do you have a family member, a loved one in a nursing home? Why don't you share this podcast with someone who works in a nursing home and encourage them to share it with team members? We know that there are many individuals out there that are really committed to the protection of the elderly in nursing homes. There are amazing centers out there that are long-suffering and patient and caring and loving towards our seniors. However, elder abuse is prevalent, and it takes a village, a country, a society to prevent the abuse of the elderly. Thank you for doing your part by sharing this podcast. See you next week.